The human body has a way of telling on itself. Long before a cardiologist ever puts a stethoscope to your chest, your skin, your eyes, even the shape of your fingertips can be quietly signaling that something inside your circulatory system needs attention. None of these signs, taken alone, are proof that disease is present, but they're worth understanding because recognizing them early gives you something valuable. Time. Time to ask questions, time to get tested, time to make changes before a small warning becomes a major event. I'm Dr. Wilson. I spent close to a decade working emergency medicine, and in that time, I watched countless people arrive in crisis with conditions that have been quietly building for years, often showing visible clues the whole time. My purpose here isn't to alarm you. It's to help you read your own body a little more fluently, so you have more chances to intervene before things escalate. Let's begin with something many people notice but brush off: swelling around the ankles, feet, or lower legs, particularly by the end of the day. Press a finger into the skin, and if it leaves a small dent that slowly fills back in, that's a sign fluid has accumulated in the tissue, something doctors refer to as peripheral edema. There are plenty of harmless explanations for this. Long periods of standing, hot weather, a salty meal, certain medications. But it can also point to the heart losing some of its pumping efficiency. When cardiac function weakens, blood has a harder time returning through the veins, pressure builds on the venous side, and fluid gets forced out into the surrounding tissue. Gravity pulls it downward, which is why the ankles and lower legs are usually the first place it shows up. Someone confined to bed for long stretches might notice it settling in the lower back instead. This becomes more meaningful when the swelling persists, when it worsens week over week, or when it shows up alongside breathlessness, unusual tiredness, or a racing heartbeat. A young, active person who's been on their feet all day and notices mild puffiness has little to worry about. But for someone in their 50s or beyond, or anyone with elevated blood pressure or blood sugar issues, new or progressive swelling deserves a conversation with a physician. It's also worth remembering that fluid retention isn't exclusive to heart trouble. Kidney and liver conditions can cause the same appearance. So this sign isn't a diagnosis on its own, but it's a strong enough signal to warrant a closer look when there's no obvious harmless cause. One more note worth flagging. If only one leg suddenly becomes swollen, warm, and painful, unlike the other, that calls for urgent medical attention, since it could indicate a blood clot rather than a circulation issue. Next, let's talk about something that looks entirely different: small, soft, yellowish patches that develop around the eyelids, typically near the inner corners of the eyes. These are deposits of cholesterol sitting just beneath the skin's surface. On their own, they're painless and don't interfere with vision, but they can offer a window into what's happening deeper inside your arteries. Cholesterol itself isn't the enemy. Your body relies on it to build cell membranes, produce hormones, and synthesize vitamin D. The trouble starts when certain types, particularly LDL cholesterol, remain elevated for long stretches and begin depositing where they shouldn't, inside artery walls, contributing to the narrowing process known as atherosclerosis, and also just beneath the skin, which is where these yellowish patches originate. Not everyone who develops them has dangerously high cholesterol, and not everyone with high cholesterol develops them. But research consistently shows a meaningful link between this visible marker and elevated cardiovascular risk, independent of other contributing factors. What makes this sign so useful is that you don't need a lab test to catch it. You simply need to look. If you notice these patches forming, especially if heart disease or cholesterol issues run in your family, it's worth requesting a lipid panel. The encouraging part is that dietary changes, physical activity, and medication when appropriate can meaningfully lower cardiovascular risk, even if the visible deposits themselves fade slowly or not at all. Catching this early opens the door to early action, and that's where the real benefit lies. Staying with the eyes a moment longer, there's a subtler sign that's easy to overlook unless you know to look for it: a pale gray or whitish ring forming around the outer edge of the iris. This is known as a corneal arc, and in people over the age of 60 or 70, it's an extremely common and generally harmless part of aging. The story changes, however, when it appears in someone younger, particularly under 40 or 50. This ring forms as cholesterol and other fats accumulate along the outer rim of the cornea. In older adults, it's largely considered a natural consequence of aging tissue. In younger individuals, though, it more often points to an underlying issue with how the body is processing fats, whether that's elevated cholesterol or triglycerides circulating in the bloodstream. There's solid evidence connecting an early appearing ring like this to increased cardiovascular risk, especially among men and those with family histories of early heart attacks or strokes. It causes no pain, no blurred vision, no discomfort of any kind, but it quietly suggests that lipid metabolism may not be functioning as it should. Age is the key factor here. Someone in their 20s or 30s who notices this ring forming should treat it as a prompt to get their cholesterol checked. Someone in their 70s likely has little to worry about, though if it appears alongside other markers like the eyelid deposits mentioned earlier or unexplained fatigue, it's still worth mentioning to a doctor. Now we move into signs connected to how well oxygen is actually reaching the body's tissues. The first is unusual paleness or a blotchy, uneven skin tone, particularly during physical effort. You might notice someone's complexion turning strikingly pale while climbing stairs, with their hands and feet developing a mottled, discolored appearance after only mild exertion. This reflects the circulatory system struggling to keep pace with demand. A properly functioning heart increases its output during activity to deliver more oxygen-rich blood to working muscles. But when the heart is weakened, or when narrowed coronary arteries limit how hard the heart muscle itself can work, the body begins rationing blood flow, prioritizing the brain, heart, and lungs while diverting it away from the skin and extremities. That's what produces the pale, blotchy look. This particular pattern, sometimes called livedo reticularis, can reflect sluggish circulation through the small vessels near the skin surface, something that happens when cardiac output drops or peripheral circulation is compromised. It becomes especially telling when it's a new development, when it consistently appears with exertion, and when it's paired with breathlessness, chest discomfort, or lightheadedness. Isolated paleness can simply mean anemia, low blood pressure, or feeling cold. But in the context of cardiovascular strain, it's the body quietly showing that circulation isn't keeping up with what's being asked of it. Closely related, but far more distinctive, is a bluish tint appearing on the lips, fingertips, or nail beds, a condition called cyanosis. Once you've seen it, you won't forget it. That blue tinge reflects insufficient oxygen in the blood, occurring either because oxygen isn't being properly absorbed in the lungs or because circulation isn't delivering it efficiently to tissue. There are two recognized patterns. Central cyanosis affects the lips and tongue and typically points to a problem with oxygenation at the level of the heart or lungs, seen in advanced heart failure, congenital heart conditions, or significant lung disease. Peripheral cyanosis affects the hands and feet and usually reflects sluggish circulation, often because the heart isn't maintaining adequate blood flow to the body's extremities. Cold weather alone can trigger peripheral cyanosis in perfectly healthy people, but when it persists indoors at rest, in a warm room, or worsens with minimal activity, it becomes something to take seriously. Cyanosis isn't a subtle sign. It represents a genuine compromise in oxygen delivery and warrants medical evaluation. In heart-related cases, it often signals advanced or worsening disease, situations where the heart is genuinely struggling. The encouraging side is that treatment can reverse it. Improving heart function, managing fluid levels, and supporting lung capacity can all reduce cyanosis, which is exactly why recognizing it early makes such a meaningful difference. Now consider something more specific: clubbing of the fingers, where the fingertips become enlarged and rounded, and the normal angle between the nail and the nail bed flattens or even reverses. This is a striking transformation once fully developed, but because it happens gradually, people often don't notice it in themselves until someone else points it out. Clubbing is associated with several conditions, most commonly chronic lung disease and certain congenital heart conditions, particularly those causing prolonged low oxygen levels. The precise mechanism remains only partly understood, but it's thought to involve altered blood flow and tissue growth signaling in the fingertips in response to chronic low oxygen exposure. In heart-related cases, clubbing appears most often in people with cyanotic congenital conditions, where oxygen-poor blood bypasses the lungs entirely and enters general circulation. In adults, when clubbing develops later in life, it more frequently signals lung conditions such as chronic obstructive pulmonary disease, lung cancer, or pulmonary fibrosis, though it can occasionally reflect an infection affecting the heart valves, which is why cardiologists keep it on their radar as well. What makes clubbing significant is that it reflects prolonged, ongoing strain. It doesn't appear overnight. It develops across weeks, months, or years. Its presence suggests something has been quietly progressing for a considerable time, which is reason enough to seek a medical evaluation, not urgently in most cases, but certainly worth pursuing. Finally, we arrive at one of the most telling signs once you know how to look for it. Visible distension of the veins in the neck, particularly the internal jugular vein, when someone is sitting upright or reclined at roughly a 45-degree angle. Under normal circumstances, these veins are barely visible in that position. But when pressure on the right side of the heart rises, blood backs up into the venous system and becomes visibly apparent as bulging in the neck. This finding reflects strain or failure on the right side of the heart, and it's one of the most specific physical indicators of heart failure that can be observed without any equipment at all. The right side of the heart receives blood returning from the body and pumps it toward the lungs for oxygenation. When the right ventricle struggles, whether due to back pressure from left-sided heart failure, increased resistance from lung disease, or a primary issue within the right heart itself, pressure accumulates within the venous system. That backlog appears first in the larger central veins, including the jugular vein, making it visible to the trained eye. Clinically, this is assessed by observing the neck at that reclined angle. If the veins remain visible above the collarbone, that's considered abnormal, an indication the heart isn't managing its volume or pressure load effectively. This sign frequently accompanies others already discussed: ankle swelling, breathlessness, fatigue, though it sometimes appears before any of them. Most people wouldn't recognize it in themselves, but it's something clinicians are trained to look for, and it's a reminder that a careful physical exam still holds real value, even in an age of advanced imaging and virtual consultations. Here's what matters most, though. Physicians rarely rely on a single sign in isolation. What we look for are patterns. Ankle swelling paired with visible neck veins paints a picture of fluid overload and heart strain. Eyelid deposits alongside an early corneal ring in someone of 30s points toward a lipid issue needing attention. Cyanosis combined with finger clubbing suggests chronic low oxygen, whether from heart or lung origins. These signs cluster together because they stem from shared underlying processes: compromised circulation, inadequate oxygen delivery, elevated internal pressures, and abnormal fat deposition. Picture it like the dashboard of a car. One warning light might be minor or even a false alarm. But when several illuminate together, or the same one keeps returning, it's telling you something needs attention. The body communicates in much the same way. What makes these visible signs so valuable is the window they open, the chance to act before symptoms progress or worsen. Swelling before breathlessness sets in. Cholesterol deposits before a cardiac event occurs. Paleness before collapse. That window is where prevention and timely treatment make the greatest difference. Which brings us to what genuinely shapes cardiovascular risk over time. These visible signs matter, but they're ultimately reflections of deeper processes, and it's those processes that determine long-term outcomes. The major modifiable contributors to heart disease are well understood at this point: elevated blood pressure, elevated blood sugar, smoking, insufficient physical activity, poor dietary habits, and unmanaged chronic stress. These are the forces that damage blood vessels, place strain on the heart, and accelerate disease progression over years. Blood pressure control stands out as arguably the single most influential factor for most people. Even modest elevations, sustained over time, substantially raise the risk of heart attacks, strokes, and heart failure. Blood sugar control matters just as much, particularly for anyone with prediabetes or diabetes, since elevated glucose levels damage blood vessel walls and speed up arterial narrowing. Smoking remains a direct assault on the cardiovascular system, damaging the vessel lining, increasing clotting tendency, and raising both blood pressure and heart rate. Movement, meanwhile, is one of the most powerful and accessible tools available. Regular physical activity strengthens cardiac output, lowers blood pressure, improves cholesterol profiles, and reduces systemic inflammation, and it costs nothing. Sleep deserves far more attention than it typically receives. Poor sleep quality, and sleep apnea in particular, is closely tied to elevated blood pressure, irregular heart rhythms, and heart failure. And chronic, unmanaged stress steadily elevates cortisol and adrenaline, which over time raises blood pressure, fuels inflammation, and undermines metabolic health. The reassuring part is that many of the visible signs discussed here can genuinely improve once the underlying strain eases. Swelling recedes as heart function improves. Cyanosis fades as oxygen delivery is restored. Even the yellowish deposits around the eyes can gradually diminish, slowly, when cholesterol comes under control. The body responds remarkably well to the right interventions, sustained consistently over time. Every one of these visible signs exists not to frighten you, but to inform you. They're part of the body's own communication system, and once you understand what they're saying, you're equipped to act, whether that means booking a blood pressure check, starting a conversation with your doctor, adjusting your diet and activity levels, or simply paying closer attention to the patterns showing up in your own body or in someone you care about. The earlier those patterns are recognized, the wider the range of options available to respond to them.